Seizures are a common neurological event. They are not a disease in themselves but a symptom of underlying brain abnormalities. Seizures occur due to a sudden surge of electrical activity in the brain. This surge disrupts normal brain function, leading to a variety of symptoms. Imagine a sudden electrical storm in your brain. This storm disrupts the normal flow of information. As a result, you might experience unusual sensations, movements, or behaviors. Understanding seizures is crucial for healthcare professionals. Nurses in particular play a vital role in recognizing, managing, and educating patients about seizures. This guide provides a concise overview of seizures, equipping nursing students with essential knowledge. Seizures are typically transient, meaning they have a clear beginning and end. They can last for a few seconds or several minutes. The duration and severity of seizures can vary greatly depending on the type and underlying cause. Think of a seizure like a brief electrical short circuit in the brain. Once the surge subsides, normal brain function gradually resumes. During a seizure, the person may lose awareness or experience altered consciousness. The time after a seizure, known as the postictal period, is characterized by confusion, fatigue, and muscle soreness. Understanding the transient nature of seizures is important for both patients and healthcare providers. It helps to alleviate anxiety and manage expectations. Seizures can manifest with a wide range of symptoms, varying from subtle changes to dramatic convulsions. Recognizing these symptoms is essential for prompt intervention. Some common symptoms include motor symptoms, uncontrolled muscle contractions, jerking movements, stiffening of the body, falls. Sensory symptoms, visual disturbances like flashing lights or blurred vision, auditory hallucinations, unusual smells or tastes, behavioral changes, staring spells, confusion, unresponsiveness, lip smacking, repetitive movements. It's important to remember that not all seizures involve convulsions. Some seizures can be subtle, with symptoms like brief lapses in awareness or repetitive movements. Recognizing these different presentations is crucial for accurate diagnosis and management. Status epilepticus is a life-threatening condition characterized by prolonged seizures. It occurs when a seizure lasts for more than 5 minutes, or when multiple seizures occur in close succession without regaining consciousness. Status epilepticus requires immediate medical intervention. Imagine a seizure that doesn't stop, putting immense stress on the brain. This continuous electrical storm can lead to brain damage and other complications. Recognizing status epilepticus is crucial. It requires immediate medical attention, including airway management, intravenous medications to stop the seizure activity, and monitoring for potential complications. Section 5. Unraveling the causes. What leads to seizures? Seizures can result from various factors, and identifying the underlying cause is essential for effective treatment. Some common causes of seizures include brain injury, such as traumatic brain injury, stroke, or brain infections. Genetic factors also play a role, as some types of seizures run in families. Metabolic disturbances like electrolyte imbalances, low blood sugar, and drug withdrawal can also lead to seizures. Brain tumors are another cause, as they can disrupt normal brain activity. Developmental disorders, including cerebral palsy and autism spectrum disorder, are also associated with seizures. Understanding the potential causes of seizures helps healthcare providers conduct a thorough evaluation and determine the most appropriate diagnostic tests and treatment strategies. Section 6. Triggers. Identifying and avoiding seizure provokers. Certain triggers can increase the likelihood of seizures in individuals who are susceptible. Identifying and avoiding these triggers is crucial in managing seizures effectively. Common triggers include sleep deprivation, stress, alcohol and drug use, flashing lights, medications. Educating patients about potential triggers empowers them to take proactive measures to minimize seizure risk. Lifestyle modifications and medication adherence play a vital role in seizure management. Section 7. Classifying seizures, a system for understanding. Seizures are classified based on their characteristics, such as the area of the brain involved and the type of symptoms they produce. The International League Against Epilepsy, or ILAE, provides a comprehensive classification system, which includes focal seizures, which originate in a specific area of the brain and can cause a variety of symptoms depending on the location. Generalized seizures, which affect both sides of the brain simultaneously and often involve loss of consciousness. And unknown onset seizures, when the beginning of the seizure is not witnessed or captured on EEG. This classification system helps healthcare providers communicate effectively about seizures, guide treatment decisions, and predict potential outcomes. Section 8. The nurse's role, managing seizures effectively. Nurses play a crucial role in all stages of seizure management, from recognizing and responding to seizures to providing patient education and support. Before a seizure, nurses should obtain a thorough medical history to identify seizure type, triggers, and medications. They should educate patients and families about seizure first aid and safety precautions. Also, they should ensure a safe environment by removing potential hazards and having suction equipment and oxygen readily available. During a seizure, nurses should protect the patient from injury by cushioning the head, loosening restrictive clothing, and not restraining movements. They should observe and document seizure activity, noting the duration, type of movements, and any other symptoms. Administering medications as ordered, such as benzodiazepines, which are commonly used to stop seizure activity, is also essential. After a seizure, nurses should assess vital signs and level of consciousness. They should reorient the patient and provide reassurance. Documenting the seizure and any interventions provided is crucial. Finally, educating the patient and family about seizure management and follow-up care is important. Section 9. Importance of accurate diagnosis and treatment. Accurate diagnosis and timely treatment are crucial for optimal seizure management. Early and accurate diagnosis allows for prompt initiation of appropriate treatment, potentially reducing seizure frequency and severity. Comprehensive evaluation, including a detailed medical history, neurological examination, and diagnostic tests such as EEG and brain imaging, is essential. Treatment options vary depending on the underlying cause and seizure type. They may include medications, lifestyle modifications, and in some cases, surgery. Regular follow-up with a healthcare provider is crucial to monitor treatment effectiveness and make adjustments as needed.